So we're here continuing to speak about research papers and trying to pull clinical applications out of them. Now here what we're talking about isn't absolutely clinical application as far as treatment's concerned, it's more about motor learning. So this is more on the educational side, so suggestions for students. Now one of the things in both of these papers, which we'll link to below, that they talk about is the idea of motor observation. So within motor observation, what seems to happen is S1, or the primary sensory cortex, is stimulated, and also at the same time, when the primary sensory cortex is stimulated, we're also getting motor stimulation without actual motion, or in some case, depending on how somebody is watching, you actually get motion, but for the most part, we're talking about the concept of motor imagery, or an analog to motor imagery, although it's not specifically stated within these papers. So both of these papers suggest that motor observation will essentially stimulate S1. Now, one of these papers, what they're speaking about is they have a reaching task, and they have a tutor showing the reaching task. Now, what they found is that if they stimulated, so they used, I think it was sensory evoked potentials, so, and I believe they used the median nerve, if I remember correctly, so they essentially stimulated the median nerve while the participant in the experiment was watching the tutor, or the video of the tutor, I believe, do the reaching task. When they stimulated the same arm, they actually essentially had poor outcomes with motor learning. If they stimulated the opposite arm, so say the reaching task was being done with the right arm, they stimulated the left arm, what ended up happening was they had similar or no change in motor learning. So what they identified was that if the hand that the person was observing learning occurring in was stimulated, we had interruption. Now, let us just say, for whatever reason, a student is being taught motion in an osteopathic setting, osteopathic educational setting, or any other manual therapy for that matter. So they're being taught a sequence, right, a motor sequence, right, or they're being taught a separate motor sequence, whatever it happens to be, right, regardless of what the sequence is. If they're observing, they're using their eyes to watch. What we don't want, or what the application from this research would suggest, is we don't want the hand that they're observing to be occupied. So in the case of osteopathic manual therapy, right, whatever sequence that we're learning, right, regardless of what it is, we would ideally want the student's hands to not be occupied, or the hands that are being used. And in most cases, in osteopathic manual therapeutics, both hands are going to be utilized. So one is a motor hand and one is a sensory hand, or as in the case of something like this, there's going to be a pattern that's going to be observed, right? So changes where both are involved. Now if a student's sitting down and taking notes, both of their hands are probably occupied, so it may have the opportunity to disrupt motor learning. So my suggestion, based on this information, based on this research, is for students who are observing and learning a motor skill, don't take notes while you're watching. Take notes subsequent to watching, subsequent to practicing. So dedicate to learning the motor skill, dedicate to observing it, dedicate to practicing it. Subsequent to that, take notes. Or if you have to, maybe one person in the class takes notes and you take turns, whatever it is. But because of this information, my suggestion would simply be, don't have your hands occupied doing a different task or creating stimulation that would take you away from observing. Stay in the observing mode, pay attention to the demonstration, and then go ahead and practice it. But keep your hands, or whatever portion of your body, unoccupied so that you're not creating that sensory stimulation.